Today I have some updates on our preparedness for Phase 3 and the work that we're doing to help individuals and small businesses move forward as safely as possible. One of the things that we're able to do with the extra time is we took in Phase 1 and 2 was develop very detailed guidelines for industries like construction, for office space, and for houses of worship. For Phase 3, we're developing guidelines as well in multiple languages for indoor fitness, museums and cultural spaces, and outdoor events. We'll also be hosting online workshops for indoor and outdoor events, performance venues in arts and culture, and tours and activities in the tourism industry. We'll begin posting material by the end of this week as we move forward. I'm also going to provide some updates on some of the work that we're doing to support small businesses during both the closure and the recovery periods of COVID-19. I want to first say a word about the purpose of the relief funds. We have been confronting 3 crises here at the same time in the city of Boston: a health crisis in COVID-19 pandemic, and economic impacts of this pandemic, and the ongoing impacts of systemic racism. Our response has been collaborative, comprehensive, and equity-driven, and we prioritize meeting the most urgent needs of the vulnerable residents and our small businesses in our city. So our relief and resiliency funds have been part of a broader strategy, and they have played a very essential role here in the city. They're supporting COVID testing at community health centers all across the neighborhoods. They're helping thousands of families make their rent payments. They're helping thousands of small businesses recover and open safely here in Boston. They have brought food and care to our seniors who have been isolated by this virus, and families who are in quarantine. These funds are emergency responses to a life-threatening situation, and they have absolutely saved lives. I am proud of how our city has come together to support the vulnerable residents and businesses all across Boston. I'm grateful for both our emergency budget resources and our resiliency fund donors. We are committed to building on this work through our recovery to create a more equitable community. Just a small example, our Small Business Relief Fund has now given over $6.1 million to nearly 1,700 businesses across every neighborhood in the city of Boston. 50% of those businesses are owned by people of color. They're in industries most affected by COVID, including restaurants and small retail stores, hair and nail salons, child care and personal care. In addition to the Reopen Boston Fund has gotten $1.5 million out to 800 different businesses with 15 or fewer employees. These are grants for PPE, cleaning products, construction material for a safe reopening. That fund is still taking applications. We're asking people to go to boston.gov/reopening. We also have new supports for restaurants and their customers that I can share today. Since outdoor dining began, we have granted over 300 restaurants a temporary license to provide on-street dining. In that time, the Commission for Persons with Disabilities have been working with other city departments to ensure that new eating spaces are accessible and the paths of travel on the sidewalks are not obstructed. To increase access, we are now providing restaurants with portable mobility ramps. If your restaurant's permitted for outdoor dining, you can request a portable ramp by emailing ada@boston.gov. That's ada@boston.gov. Ramps are already being provided on a rolling basis, along with a toolkit with information on setting them up, a sign with information that restaurants can hang up, and best practices on providing the service to people with disabilities. I want to give a special shout out to Commissioner Krista McGosh and her team for leading this work and doing some amazing work here in the city of Boston. They are unsung heroes in our city, always looking out for the needs of disability community and making sure their concerns are part of all of our planning here in Boston. They make us stronger and more inclusive as a community. Later this month, we're going to be celebrating the 30th anniversary of the signing of the Americans with Disabilities Act, a truly groundbreaking piece of legislation that changed our country for the better. It takes vigilance, investments, and advocacy to implement that law. And that's what we are committed to doing with the support and guidance of the community. It's also important to know that many members of our disability community have medical vulnerabilities. They are risk factors for COVID-19 illness. If you are out and not wearing a mask or not properly distancing, you are sending a message to many people that area may not be safe for them. That means fewer places that people can go for fresh air or mental health breaks. And that's inequity. So I ask everyone again about the impacts of your actions and what they have on other people. As I've said, we are seeing disturbing numbers in many parts of the country right now, still continuing over the last weekend that we just experienced. This is not time for us to let up here in Boston or Massachusetts, either in our collective risk management or our personal precautions. So I'm going to keep repeating these steps for as long as it takes. And we're going to keep doing all of them as long as it takes and for however long we do it. We're asking people to continue to wear a mask when you're outside your home. We're asking people to maintain 6 feet of distance, space from other people. We're asking you to stay away from crowds or gatherings where physical distancing is not possible. We're asking you to wash your hands as often with warm water and soap and wipe down surfaces and disinfect those surfaces. We need everyone to be focused on what they can do. You have made a big impact here in the city of Boston on a daily basis by doing all of this. So we're also asking you to continue to do that. Government also has a responsibility, and we're working every day to meet that responsibility with science-based decisions, clear information, and the material relief for those people who need it. Businesses and nonprofits also have a responsibility to follow the guidelines and manage the risks for all of your workspaces and your employees who are coming back to work. Individuals have a responsibility to follow the guidelines as well and look out for the most vulnerable. If we each play our part, we will move safely and successfully forward.